Welcome back on the program. The World Food Safety Day is observed annually on June 7 to highlight the importance of food safety practices and preventing foodborne illnesses and promoting public health. This year's theme, Food Safety, Science in Action, emphasizes on the role of science in preventing foodborne infections and ensuring the safety of food we consume. Now, to prevent foodborne illnesses, it is essential to practice safe food handling, support robust food safety systems, and promote education and awareness. This includes proper food handling and storage practices, such as keeping food at safe temperatures and using safe water and raw materials. Now, join us for this discussion is the Director and National Coordinator of Food Safety and Quality Program, Federal Ministry of Health and Social Welfare, Atonda John. Good morning, Mr. John. Thank you so much for joining us from our Abuja studios.
Thank you for coming.
Good morning.
Good morning to you. Let's kickstart with this particular data. Approximately 600 million people worldwide fall ill every year after consuming contaminated food, resulting to about over 400,000 deaths annually. Now, these figures are alarming. Now, how important is food safety to help curb the rise in death in the country?
Thank you very much. First of all, I bring greetings from the Honorable Minister of Health and Social Welfare and the entire management of the Federal Ministry of Health and Social Welfare, as well as the members of the National Food Safety Management Committee, whom I'm representing here. As you have said, the importance of food safety is very critical to the public health all over the world. And that is what prompted the United Nations General Assembly to proclaim June 7th of every year to commemorate World Food Safety Day in order to sensitize the entire public on the importance of food safety to our well-being and the socio-economic importance and development of the nation. And since 2018, Nigeria and the United Nations declared a World Food Safety Day that in 2018, and it's in the inception and the maiden edition was done in 2019, and Nigeria have been part of it since then. We have been commemorating the World Food Safety Day every year to food safety in order to reduce the incidences of foodborne diseases in our country.
But what impact has this day?
As you have said, concerning the data that you mentioned, it is very clear that this number is staggering, and there is need for the entire world to come to terms to the need to promote food safety across the entire food supply chain in order to curb the incidences of foodborne disease and promote trade.
Thank you for that answer, sir. But I want to ask, what impact has this day had on global food safety?
Yeah, there have been impacts. There have been significant impacts because just like we said, there is need when people are aware of the importance of an issue, and it's very evident. We every day, even in Nigeria here, we have seen how the outbreak of foodborne disease is coming out every here and there, and there's need for us to be very proactive. That is why the federal government of Nigeria take it upon itself, especially the Federal Ministry of Health, along with its stakeholders, developed the National Policy for Food Safety and Quality, which was developed even earlier, that is from 2014, but has been reviewed in 2023 and was relaunched to be able to take care of the emerging food safety issues in the country. And there's a structure on ground which we have been using to coordinate the entire food safety stakeholders in the country to ensure that the purpose and the intention of this policy and then the target of the government in reducing the incidence of foodborne diseases in the countries is curtailed.
Absolutely, Mr.
There's more awareness, and then there's need for us to continue to increase the awareness.
Absolutely, and that's why you're here to give the awareness to Nigerians. Let's talk about the theme for this year, talking about the food safety science in action. What are the common food safety practices that Nigerians should imbibe at this time to ensure that they are free from any form of infections?
Thank you very much. There is a lot of, as I said, and the food safety entails all the necessary measures put in place to ensure the food we consume is devoid of hazards that can cause foodborne disease to the consumer, that will cause disease to the consumer. So it is based on that when we talk of food safety, there are a lot of things concerned. We have to practice good hygiene practice, which I will encourage everybody, especially this time that we are in the Salah period. Hygiene practices, good hygiene practices. That's basic thing that you wash your hands. Make sure you wash your hands as often as possible. Clean all the surfaces where food is being prepared. Make sure you store the food at right temperature. When in the freezer or in the fridge, let it be between below 4 degrees centigrade, because we have a danger period danger range between 5 to 60 degrees centigrade might not be appropriate. So either it's very low, below 4 degrees centigrade, or above 60. That's when when you are refrigerating. Then you have to cook appropriately, cook to appropriate temperature, so that the heat will be able to kill all the pathogens that might have been transferred into the food. And then you try it as much as possible to separate raw food from cooked foods. Those are the 4 major concepts of ensuring food safety. That's maintain cleanliness, wash your hands regularly, cook to appropriate temperature, refrigerate under appropriate temperature, and also use good safe, clean water and raw materials in the preparation of your food.
I like that you mentioned refrigeration of food, but what options are available for those who don't have refrigerators or fridges or cold rooms? Did you hear my question,
Hello?
sir?
I didn't hear you.
Okay. I said that I like the fact that you mentioned refrigeration of foods as a food safety mechanism. But I want to ask, for those who don't have refrigerators or fridges or cold rooms, what options are available to them?
Well, I will advise that refrigeration is one of the options that you can use to preserve the food. But if you don't have, there are other ways, other means of keeping your food. At least you prepare the one that is within your means, that you will be able to you can finish. And if there's the warming, you can warm the food as often as possible. But the best thing is that hygiene is very, very critical, so that at least let the germs not be introduced into the food first. Once introduced, even if you refrigerate, even if you heat, at times it might not be able to take care of the food. To remove the germs. There are some toxins that might be in the food that the heat might not be able to remove. And then when you even refrigerate, it doesn't mean that the refrigerator kills the food, the pathogens in the food. It only keeps them static. We call it bacteriostatic effect. And then when you now warm it, it is better as much as possible to maintain I mean, to have been the level where they will not have leftover if the facilities are not there.
So how many days will you advocate at this time? That we've had different perceptions saying that Nigerians, you can refrigerate your food for a week. Some will keep the food there for 2 weeks. How many days would you advise Nigerians to refrigerate their food for them to consume?
Well, you can refrigerate food as much as you are able to maintain the temperature, appropriate temperature, the way it is safe, it can be safe. No, but because of the issue of power supply in the country, you might not be able to guarantee the quality, the safety of the food if it has been kept under refrigeration for long.
So tell us, what are the dangers attached to this issue of not practicing proper hygiene? And what are those things Nigerians should be aware that this could lead to death if you don't practice appropriate hygiene at this time?
As I've said, personal hygiene is very, very critical. But even for the food handlers, for the consumers, even in your on individual basis, at home, food hygiene, personal hygiene is very, very critical. It is true when the one is not the hygiene, the hygiene is the personal hygiene is faulty. Let me put it that way. That you realize that the food might have been contaminated, and you might not be aware. So that's why
I'm talking about the illnesses that will come up, so that Nigerians can be aware that they can have these. Can you mention them? That's what I'm saying.
Yeah, there are a lot that we have some what we call foodborne diseases and food or diet-related diseases. But for foodborne diseases, as a result of hygienic practices, you have cholera, diarrhea, typhoid, or different form of gastroenteritis that can lead to death. You have maybe having, especially, let me just say cholera, especially. Diarrhea is there, and then other associated diseases that will come up. You have botulism, you have there's some disease caused by Escherichia coli.
Okay, thank you, sir, for your response. So some of us are in the habit of eating out, maybe due to you can't cook, due to the fact that maybe you can't cook, or maybe you're rushing somewhere and you forget to cook your own food. And I like the fact that you mentioned personal hygiene, but then you kind of can't control what a restaurant or a booker, for example, how they cook their food. So what are the things that consumers should look out for whenever they want to choose a restaurant to go buy food from?
Yeah, that's a very good question. That by the time everybody is conscious of your health, of what you consume, you consider the environment where the food is being prepared, how they have been treating, how the waste have been treated, how the food is being cooked, how how clean the environment is, and how even the people that are preparing the food, from their look, from the way they practice what they do, whether they are using the same water to wash the plate, they used to do another things. But environment, first of all, you have to consider if the environment is clean, is hygienic, before you say you want to eat in that place, and then you have to consider even the people that are preparing the food. At least if somebody is preparing the food that they have long nails, or is the person having wounds on his hands, or on the body, or rash, or have rashes on the body, if you know that it's not kind of area you can do. And then especially the waste, when you see animals like pets, birds, dogs, or ghosts moving around, it's not and it will not be an ideal place to eat.
You know,
so you have to consider, look at the environment very well.
When you
look at
when you give all these criteria and you look at the standard of living of Nigerians, how many of them can afford to eat at that particular place that you're recommending at this time? If you can answer that in 30 seconds.
No, it's just, it's just a matter of, what would I say? I say the consciousness. If everybody is conscious of hygiene, of our health, of the safety of the food we want to eat, if the person is cooking their food, if you realize that everybody is aware, nobody will patronize the person. So better let that consciousness of the safety of what we want to eat be there in the mind of every Nigerian. That is why we said food safety is that is the slogan of World Food Safety Day. Food safety is everyone's business. Absolutely. So let everybody, even the consumer, to play his part, the manufacturer will play his own part, the food vendor will play his own part. If you see something that is not good and then you talk to the owner of the bukateria, why are you doing this one? This is not I did. This and you are playing your own part, and then the person will be conscious.
Absolutely, absolutely.
And then there will be a change.
It's a fine place to live in. There's this general saying that cleanliness is next to godliness. Director and National Coordinator, Food Safety and Quality Program, Federal Ministry of Health and Social Welfare, Atonda John. Thanks so much for joining us on the program this morning.
Thank you very much.